Okay, we can go ahead and get started. Hi everyone, my name is Juliana. Thank you for everyone for attending today's workshop. I will be the moderator for this session. We'll also be having Tama, who's going to be assisting us with technical issues. Before we jump in, there are a few housekeeping items to discuss. So if you have any questions for our presenters, please ensure that you're using the Q&A feature on the bottom bar of your Zoom application. Our techie volunteer, Tama, will be helping to monitor our chat as we go along with our session today. And then lastly, the event will be recorded, but attendee information will be kept confidential. I am happy to introduce you to our presenter for today's DKICP information session. Dr. Roy Gu is a pharmacist and faculty staff at the Daniel K. Inouye College of Pharmacy at UH Hilo. As an associate professor and department chair of pharmacy practice, Dr. Gu is very familiar with the program in Hilo and will be sharing information about DKICP with us today. It gives me great pleasure to welcome Dr. Gu.
Wow, thank you for that awesome introduction. There's actually already a question in the Q&A, so before I get started, I'm just going to address that. The question is about the pre-pharmacy scholars admission program, what that is and whether or not it's a good option. So I think it's an awesome option. Obviously, I'm biased, but what it is basically, if you know you're going to go into pharmacy and you apply to this pre-pharmacy scholars program, it secures you a spot in our class as long as you meet certain requirements, a minimum GPA, as well as pass the interview process. And the reason why I think it's a really awesome track or program is that it takes some of the anxiety and takes some of the focus away from your grades. The prereqs for pre-pharm include things, or for pharmacy include things like organic chemistry, things like that. And to be completely honest, you'll never use that stuff ever again. It's kind of, I don't know why we do it. It's, med school is the same way. It's kind of like they make you jump through these hoops, they make you do these courses to prove that you can succeed academically, but the content itself isn't actually ever used again. And so what I find, one of the problems that I see with students is that it's kind of ingrained in you that you need to get good grades, and that all that matters is getting good grades, because good grades is going to equal you getting into the school that you want to get into and eventually the career that you want to get into. And the problem with that is that when you get into pharmacy school, some students have a hard time switching the focus from grades to patient care. And so I always tell my students, and this is something that my mentor told me when I started pharmacy school, is that, everything that you've done up to this point has been for you, so that you could get the grades that you need to get into the school you want to get into. But once you're in pharmacy school or medical school or dental school, everything that you do is for your future patients. I really don't care what grades you get, how your test scores are. What matters is that you retain the information, you know how to apply the information so that you can provide good patient care. And I think a lot of students struggle with that. And so what I really like about the pre-pharmacy advantage program is it takes some of that focus away from grades, and it allows you to focus more on how do you develop yourself as a person and as a professional. So as long as you keep up a certain GPA, that's all you need to do. And you're assured that you're going to get into the school as long as you pass the interview. So you can focus on things like community service. You can focus on things like internship experiences, or just developing yourself as a person and a professional and growing up and getting life experience. And so I think that's a big benefit. And really, you still have the option that if you go into that program, you still have to fill out the formal application when you choose to apply. And so if for whatever reason you change your mind, like, I want to go into medical school instead, or I want to go to a different pharmacy school, you can still do that. It doesn't stop you from applying to a different school. And so it's kind of like you have that in the bag, the pressure's off, you just got to keep up that GPA, you got to pass your interview. So I really think it's a win-win situation. And so I think the second part of that question was, should you do your bachelor's degree and then attempt admission, or just do that pre-pharmacy program and then apply to pharmacy school without getting your bachelor's degree? So I have kind of a unique take on that. I actually am from a pre-pharmacy program. When I went to school 15 years ago, oh God, that's a long time. I'm getting pretty old. Thanks for reminding me of that. I did a pre-pharmacy program. So I did 2 years of undergrad and then went straight to pharmacy school. And the pros and cons of that is that one, you save a lot of money. I saved 2 years of undergraduate, time. I saved 2 years of time. Also saved 2 years of tuition. So that was a huge advantage. But again, you are cutting your college experience short, and it's a very intense. In order to finish all the prereqs in 2 years, it's a somewhat intense course load. So you really have to weigh that getting out earlier, making money earlier, decreasing your student loans with kind of life experience and enjoying your college experience and things like that. So it really depends on you and your personal situation. If you can afford to go to school, then go to school forever, But if you are worried about student loans, like I think most people are, and I definitely am, was and am, I'm still paying them back. Then then I would probably just do my prereqs and go straight into the program as opposed to finishing my bachelor's. And if you don't get in for whatever reason, you can fall back, finish your bachelor's, and then apply again. So that's kind of my take on that. But does that answer that question? Are there any other questions kind of surrounding that? Great question, by the way. And go ahead and you can type in either the chat or the Q&A. I'll assume that answered the question. So I'm just gonna talk a little bit more about pharmacy. So again, I'll talk a little bit about the program, but I'm going to talk mostly about where pharmacy is going. And I think that's really important because I think that a lot of students go into pharmacy for the wrong reasons or not necessarily know what they're getting themselves into. And I think that's even more so true now than it was in the past because our profession is very rapidly changing and evolving. Typically, when people think about pharmacy and what pharmacists do, they think about longs. They think about your retail pharmacist who's back there, filling prescriptions, counting pills. And a lot of people go into it just honestly for the paycheck. But I really think that aspect of pharmacy is dying. It is changing. There will always be pharmacists in the retail setting, but I think that you're going to see that their job and their role is going to look very different in the next 5 to 10 years. So basically, by the time you get out of school, that role of the community pharmacist, of the retail pharmacist, is going to look very, very different, where they're not just going to be dealing with insurance and filling prescriptions and checking for interactions, but they're really going to be actively managing patients and providing both chronic and preventative care services, as well as even some acute care. So the big driving, there are going to be two things that are driving the shift in our profession. The first is access to care. And as you can see here, there's this huge shortage of primary care providers. Even as there are more medical schools are opening up and more graduates from medicine are coming out, those graduates tend to want to specialize because the money's better. And so we still are going to have this huge shortage of primary care providers. It's estimated by 2032 that we're going to have probably 25 to 55,000 providers short. And so when you look at where we are right now, the typical physician panel is about 2,500 patients. And if you look at the guidelines for these different disease states and kind of the recommended services that you should provide in helping to manage these chronic conditions like heart failure and diabetes and helping to prevent, maintain good health and prevent complications, you're really looking at, for those 2,500 patients, about 5,000 hours of work. And that is 2.5 times the normal number of hours in a year. So what that leads to is it's estimated that patients only get about 50% of the care that per guidelines based on evidence of what's going to keep them in good health, they only get about 50% of what they're supposed to be getting. And it's not because physicians are doing a bad job, it's because they don't have the time, right? Because there's such a shortage. So you're going to see that the role of pharmacists really evolve to better meet the needs and improve the access to care. And it makes sense because approximately 1/3 of adults take 5 or more medications. So medication therapy is a huge part of patients' health. And no medication is 100% safe. 5% of all hospitalized patients will experience some sort of adverse drug event or some sort of side effect. And that leads to about 1.5 million preventable medication-related events each year. And it costs us about 200 billion. So it's a huge cost. There are different types of medication therapy problems, and it really takes a drug expert, which is what you'll be trained to be when you graduate pharmacy school, to identify and address these different problems. And so what is a pharmacist? A pharmacist is someone who applies the knowledge, experience, and skills to assure optimal medication-related outcomes. And in this day and age, it's really going to be to address two main aims. The first is, like I mentioned, to increase the access to care. So you're going to see pharmacists do a lot of blood pressure management. Right now, I have several projects going on where we have pharmacists who are prescribing, changing medications, providing education, providing dietary consultations, lifestyle consultations to help better manage things like diabetes, hypertension, heart failure. We have pharmacists who are doing, of course, vaccinations. Pharmacies have now become the primary place where patients get some preventive care services like vaccinations. Pharmacies and pharmacists can also do CLIA waived lab tests. So these point of care testing where we can test for things like strep throat, influenza, COVID-19. So, when you're sick, instead of having to go see a physician and make an appointment and possibly not be able to get in, you can go to a pharmacy and they can say, okay, you're sick, let me test you. Looks like you have the flu, give you medications if appropriate, or give you education on what to do. Other things is birth control. Pharmacists can now prescribe birth control, and Plan B is in fact over the counter. So there's going to be a lot of those things that pharmacists do to improve the access to care. And then the quality of care. So right now, the medical system is what we call a fee for service, meaning that you come in and see a doctor, it costs you $50, right? You come in and get a mole removed, it's $100. So anytime you see a physician, the physician gets reimbursed a certain amount of money. And so that's not really the best way for promoting health, because in essence, it kind of encourages you to be sick, right? As a physician, I'm going to make more money the more times I see you. So if you're sick and you have a lot of things wrong with you, the more times you come in, the more times I get paid. So what we're really moving towards is what we call a capitated or value-based reimbursement, which is basically, I'm going to get $100 every month to take care of my patient. And it doesn't matter how many times they come in, it doesn't matter what I do, I'm going to get $100. So it really behooves me to keep you healthy because I can get $100 and not even have to see you because I'm keeping you healthy. On top of that, some of the reimbursement is tied to what we call quality measures, meaning that, okay, you'll get $100 per patient, but if the patient's diabetes is not well controlled, we're going to take away $25 from you. Or if the patient is doing a really good job, we might add on $25. And so pharmacists are being utilized a lot to improve the quality, to make sure these patients are getting their immunizations, to make sure the patient's diabetes or hypertension is well controlled, so that we can maximize that reimbursement. And in the grand scheme of things, really decrease the overall cost of health. Because really the big cost is when that patient has complications, it goes blind, or has to get a leg amputated from diabetes, gets admitted for a heart attack. That's where all the cost is. And so if we're able to take better care of our patients, improve these quality measures, the overall cost of care goes down. And so a lot of organizations already use these models. Kaiser, the VA, the government, like the Department of Defense, like Tripler Army Medical Center, where I used to work. So it is not a new model, but it's now starting to become more and more prevalent in that private care, private practice setting. Okay. So we're really moving towards team-based care. And the whole theory behind this is medicine has become so sophisticated and complicated that one person can't do it all anymore. So, back in the old days, they had a physician, and that's all you needed, because he could do everything. But now we have hundreds of thousands of different medications. We have different procedures where everyone really needs to specialize in order to provide the best care. So I think of it like an automobile assembly line, where back in the old day, one person would put together an entire car. But they figured out that they could do a much better and much quicker job if one person just put on the wheels and it went to the next person who specialized in putting in the electronics. And so that's really what medical care is becoming, really more team-based. And so the goal of team-based care is to provide high quality, cost-effective, and accessible healthcare for patients. And again, to improve quality and decrease the total expenditures. So what does a pharmacist do? They work directly with physicians, other healthcare professionals, and patients to ensure that medications contribute to the best possible health outcomes. And this allows us to increase the capacity, so how many patients, how productive the medical team is, and also the access to care. So what do we do? How do we do that? And this is where DKICP comes in, is we're undergoing a curriculum transformation right now that's really going to focus on providing the skills that a pharmacist needs to do these following things: to assess the status of the patient's health problems, to evaluate the appropriateness and effectiveness of medication, to recognize any untreated health problems. So that's a big thing, where a lot of times we'll catch things because we're out in the community, because we're more accessible, that other providers or other healthcare providers might miss. Monitor the patient's progress, provide expert consultation, and then patient education. So we're really teaching our graduates to think independently. And the reason for that is that if we're taught, and everyone thinks that, okay, pharmacists, we just do what the physician says, we just follow their directions, but that's really not the case. If we did just follow what everyone else did, that's how medical errors occur, because everyone's thinking the same and no one catches it. But the model that we try to look at is like the Swiss cheese model, where we know that every layer has holes where a medical error could occur. But hopefully when we put those slices together, those holes don't line up, so that even though the physician may make an error, the pharmacist will catch it. Or if it slips by both of us, the nurse will catch it. So we're really training everybody to think independently, figure out what's going on, figure out what's the best course of action, and then work together to come up with a plan that's the most effective and safe for that specific patient. So I always like to say, like, this is a movie, I was looking for the good, the bad, and the ugly, and I came across this. The good, the bad, and the weird. Because when you talk about medicine, this is basically what happens. Good things happen, bad things happen, and then really weird things happen. So I've actually never seen this movie. It looks like a Korean movie. It looks like it won a bunch of awards. But the analogy is that really, as a pharmacist, what you are going to be dealing with is the weird stuff. When most physicians, a patient comes in with pneumonia, they know, okay, this is generally the first antibiotic that I should use. But what happens if the patient has an allergy? Or what if the patient has some weird organism that's not covered by the antibiotic, or has an adverse effect or side effect of that drug? What do I do next? And that's where a pharmacist provides that expert consultation to help give the correct medication. So our whole curriculum is kind of centered around this patient-centered care process, where we learn how to collect data, how to assess that data, come up with a plan, implement that plan, and then monitor and evaluate how the patient's doing and change the plan if needed. So what's involved in this is, collecting subjective, objective information. Questions that we ask are, what patient-specific factors may affect the efficacy of a particular medication? Are there allergies, interactions, adverse effects that may change what medication we choose? Is there any missing information? Like, is there a lab that I need? Is there something I should ask the patient? Like, have you been traveling? Because that might change what bacteria they've been exposed to. Is what we're doing working? Have all the factors and concerns been addressed? Do I need to modify anything? And then we come up with a plan with by determining goals of therapy with that patient and with the care team, making sure that our plan is evidence-based, so based on guidelines and the most current evidence, and then making sure that it's cost-effective. We're going to monitor that plan, making sure that it's working and that the patient isn't having adverse effects. Communicate with both the patient and caregivers to make sure, we can have the best plan in the world, but if the caregiver, the patient isn't able to follow those instructions or isn't doing the plan, then we need to figure out what would work for them so that they will participate in their care. So an example, so a little bit about my background is before signing on with the college, I was an infectious disease pharmacist with the Army. So I worked at Tripler Army Medical Center. I worked in out of the ER, dealing with a lot of infections. I was the infectious disease specialist, took care of some of the ICU patients. And so a day in my job involved really promoting the optimal use of antibiotics. And what that means is basically making sure that we pick the right antibiotic, making sure it's the right dose, that we start it in a timely manner, and that when we know, when we initially start antibiotics, it's a best guess. Like, okay, based on your risk factors, based on your history, these are the organisms I'm worried about, so I'll pick antibiotic X that will cover those organisms. But once I get the culture and sensitivity back, once I get the lab results back, I then want to narrow down the antibiotic therapy so I'm not overusing antibiotics. It's estimated that somewhere around 50% of all antibiotics are used incorrectly. And that leads to antibiotic resistance. That leads to a lot of increased drug costs and a lot of other things. And so my job as an IV pharmacist was to prevent that from happening. Okay. Other things I did is I managed the formulary. So you can change prescribing habits by determining what should be in formulary and what shouldn't be. Looked at data, use that data to make decisions and come up with policies and procedures, provided education. So basically, these are all the things involved in making sure that antibiotics are being used correctly. And so to give you an example of what that looks like, here's a patient case. So we have this patient here, JJ, is a, what was that? Is it 35 or 55? I forget. I wrote this case a while ago and it's, oh, there we go. Oh, no. Sorry, the little Zoom window is like blocking that. So anyway, 35 or 55, he's some dude who has a history of worsening shortness of breath, subjective fevers, right-sided chest pain, productive cough. He's usually in good health and denies any sick contacts. So, it's not the flu or anything like that. He was hiking to Manoa Falls when he caught in a downpour, started feeling bad the next day. He's been taking up over-the-counter medications, but really hasn't been getting better. And so what I'm looking here are for clues of what might the problem be. And so based on his worsening shortness of breath, I know that this is most likely a pneumonia. Based on his social history, he lives at home, works as a hotel valet. He's not a nurse or a doctor where he would be exposed to more resistant bacteria. So I can kind of narrow it down to what bacteria it's probably going to be. He has no known comorbidities, so no additional risk factors for more resistant organisms. There are some labs that are out of whack here, like his white blood cells are really high. His serum creatinine, I might have to dose adjust his medications. So based on that, I can kind of guess that these are the most likely organisms. Of those, probably not pertussis. He probably got vaccinated for the whooping cough. Probably not tuberculosis. He isn't a recent immigrant, doesn't share a house with recent immigrants. So these are really, I can narrow it down to, I just need an antibiotic to cover these 5 organisms. Okay. I can look at the antibiogram, which is basically a summary of the culture and sensitivity results from my area or my hospital to make a more area specific recommendation. And then I'll come up with an antibiotic, in this case, probably something like amoxicillin or augmentin or azithromycin would be good choices for this patient. So other areas, so that's kind of what a day in the life of ID pharmacist is like. But other areas that you can practice in include retail or community, like the ones at Longs, managed care, and those are the ones who work for HMSA or Ohana Health Plan, who help to decide what medications are covered and not in order to drive prescribers towards the most cost-effective and evidence-based treatments. Industry, our patients are pharmacists who work for the drug company. So a lot of my friends work in industry, and it's kind of like being in COVID-19 world for your whole life, because all you gotta do is wear a nice shirt and you can wear anything underneath. You can wear pajamas, you can wear surf shorts, it doesn't matter because most of your meetings are online. So you only gotta show this. And so they work from home and they basically educate physicians on new upcoming evidence for the drug that they're assigned to, help to manage clinical trials, inpatient, so working in the hospital, making the IV medications, checking all the medication orders that come through for patients who are in the hospital. Public health is something I do a lot now of. I work a lot with the DOH to improve care on a population basis. And then AmCare is like your outpatient clinic who manage things like COPD, hypertension, high cholesterol, things like that. So how to become a pharmacist? Again, generally 2 to 4 years. So you don't necessarily need, especially for UH Hilo, to do your bachelor's degree. We also don't require the PCAT. So those two things that you can possibly get out of the way with DKICP. And the reason why we did away with those two things, or did away with the PCAT, is there was really no correlation between the PCAT and how well you did in school and how likely you were to pass the board. So we got rid of it because it didn't give us any information. But what you do need to do is fill out an application in PharmCast. And the big thing that you need to pay, these three things are what I would pay the most attention to. So really writing a good reason of why you want to come to DKICP, why you want to be a pharmacist, being comfortable in the interview, being and maybe practicing beforehand, and then getting layers of rec from not only professors, but if your boss at work, someone who can attest to your work ethic and your character. So there's a question in the question and answer. I know there are 3rd and 4th year rotations at DKICP. Which ones will the students be able to choose from? So in short, all of them. The only caveat to that is things definitely changed with COVID. In the past, we had rotations, international rotations in Australia, Thailand, Japan, not really international, but Saipan, American Samoa. We also have rotations on the mainland. In general, you have 6 rotations in your 4th year. 4 of them are required. 2 of them are elective. And in general, we want all the required, except for retail, to be in Hawaii. But you can go and do your other rotations elsewhere. We still have rotations on the mainland that we send students to. We haven't sent anyone international during this COVID pandemic. So, depending on how that goes and where the world goes, that's the only thing that's kind of questionable. But you'll be able to choose or put in your preferences in your 3rd year. And then then the director of experientials will work with you to kind of, based on availability and a number of other things, what's in the best interest of your career and who you might mesh with best as far as preceptors will determine your rotations for you. Does that answer that question? All right. Okay, so that's in general, really what I wanted to go over as far as pharmacy and a little bit about our program. But I didn't want to talk too much about our program, but I'm more than happy to answer questions because I think the first step you got to think is, do I want to be a pharmacist? So I think that's really the more important decision that you should think about right now. You can decide where to apply to later, But yeah, what kind of questions do you have about either our program or just pharmacy in general, or medical industry in general? I've been around for a little while, so. And I don't know you, so you can ask whatever you want because it won't matter. I'm not. Yeah. This is your time to ask whatever question you want to ask, and I'll be more than happy to answer. So I see a couple coming through. Oh no. Oh yeah. What made you want to pick your specific profession? So you know how I talked about those students who go into pharmacy for really the wrong reasons. I have no idea what they're doing. I have very personal experience with that. I was 17 years old and I had a full ride to Ohio State to wrestle. And I had a girlfriend at the time. And when you're 17 years old, like that's the girl you're gonna marry, right? I mean, there's no doubt in your mind. And so she wanted to go to the University of the Pacific in Stockton, California, because her sister lived in the area. And so I had to come up with a reason of why I would pass up a full ride to go to an expensive private school. So I Googled and found out they were known for pharmacy. So I told my dad, "Hey, Dad, there's no future in wrestling. I'm not going to be a pro wrestler. I'm Asian, small. I want to be a pharmacist." He's like, "Really? I've never heard this before." No, I've always wanted to be a pharmacist. So I went. I had no idea what I was getting myself into. But I'll tell you what I like about it now, because I did actually, after I graduated, my plan was always to apply to medical school, and I did apply and I got in. And I decided not to go at the last minute because I found that I really do love pharmacy. And what I love about it is I'm a servant at heart. I really like to serve. And as a pharmacist, I can serve not only my patients, but I can serve in the context of that medical team, the physician. So there's a lot of times when the physician will do something that is probably not the right thing and I don't agree with. And I try to convince them otherwise or her otherwise, can we do this? And it's kind of a game. I like to try to manipulate people to get them to do what I want them to do, but think that it's their idea. And sometimes it works, sometimes it doesn't. And when it doesn't, I take great honor and pride in like, okay, you're not doing what I want you to do or what I think you should do, but I'm still going to back you up and I'm going to cover your butt. And I'm going to monitor the patient really carefully for the things that I know could go wrong or likely will go wrong. So at first sign that something's going to happen, I can come to you and say, you should do this, you should change this. And so I really enjoy that aspect of being able to serve. I also like that I kind of can punch out, and my personal life is very important to me. Like I have chickens, goats, I surf, I hunt, and all those things I have kids that I love to spend time with. And those things are really important to me. And I wanted a good life balance. So that's why I like pharmacy. And I felt like I can specialize in pharmacy. May I ask, that in your opinion, what's the best and worst parts? So I told you the best parts. I think the worst parts right now is that I see the impact that pharmacists could make, but the reimbursement and the economics hasn't been developed yet. So that's kind of the battle that we're facing now, is that right now our reimbursement is tied to dispensing medications. And outside of things like Kaiser and those managed care organizations, it is hard. There's no real clear-cut way to get reimbursed for those clinical functions like managing the patient's diabetes and providing expert consultation. So that is what's frustrating for me, but hopefully we solve that problem. Because, there's been several acts from the federal level to the state level that have really acknowledged how important pharmacists are and mandated the use of pharmacists in different settings. So everyone recognizes our value, but it's a battle with insurance companies on how to bill for that and how to get paid for that. So that's kind of what's my frustration. And when I was applying to medical school, I was working in the ER, and I was talking to one of my physician friends about it. And he's like, why do you want to go to med school? I was like, I don't know. I just felt, I was young. I was, 22 when I graduated pharmacy school, 22. So I was really young. So I wasn't really mature. And I was like, I don't know. It just feels like I'm not ready to work. I want to go back to school. And he's like, do you not like your job? I was like, no, I like my job. It's fine. He's like, every job, there are going to be bad days at every job. And there are going to be days that you don't want to go to work. But as long as you can stand your job, that's a really good job. So whatever profession you go into, whether it be pharmacy or any other profession, just kind of be aware that there are going to be days that you're not excited to go to work. But that's what a job is. And as long as you don't hate that job, that's a really good job. So how does DKICP help build connections? I think we're the only pharmacy school in Hawaii. So if you plan to stay in Hawaii, it's kind of a no-brainer because you're going to be able to do all your rotations here throughout school. You're going to be able to network through various avenues with different companies and people. I mean, pharmacy is a really small world in Hawaii, so it's really easy to network. What kind of internship experiences should applicants have? So any internship experience is great, but it is really limited and really hard to come by now. So I wouldn't, if you can get one, great, and any experience is good. I wouldn't stress out if you can't find one. Most applicants don't have internship experiences, but even if it's not directly pharmacy related, community service is really good. You know, even having just a regular job. Like I worked at a surf shop for 9 years before becoming a pharmacist. And I learned a lot and grew a lot as a person and learned a lot of the skills I use from that job. So I think any experience is good. And so no, you don't have to shadow or do research prior to applying to pharmacy school. It's great if you can, because more for you than anything to make sure that you know what you're getting yourself into. But you don't have to.
I have a quick question to follow up on that. Would you recommend for pre-pharmacy students to get a job as a pharm tech?
If you can, yeah. Yeah, and again, more so than anything, so you can be sure that, you know, well, it's double-edged because that's only one aspect of pharmacy. Pharmacy, and one of the reasons I like pharmacy, it's probably the most diverse profession when we talk about medical professions, right? Like in the retail setting, you're going to be dispensing medications. I don't touch drugs. I just get calls and people ask me, what should I do? And I just tell them, you know, or I work at the Department of Health and plan projects and things like that. I have other friends who just work at an office and they make decisions and they have meetings. So it's a very, very diverse profession. And that's what's good about it is as you get tired of one aspect, you can move to a different aspect and have a completely different job. So it keeps things interesting. So back to your question of as a pharm tech, yeah, it's good. And honestly, it does look good on your resume, but be aware that that's not the only aspect of pharmacy and that likely what you see and what you experience now as a pharm tech is going to change in the next 5 to 10 years based on how the way our medical system is changing. This person's a little bit nervous about the interview aspect. Do you have some advice for tackling the interview? What are some questions likely to be asked? You know, that's a whole talk in and of itself. I don't know if are you guys able to distribute my email after this? Can that
I can send it out to everyone.
Yeah, email me. I'll be happy to sit down with you and kind of do some mock interviews and kind of talk about more in depth, you know, some tactics and tips, and help you prep, you know, even right before the interview. I'm more than happy to do that. But in general, think of it like a first date. Research who you're interviewing with, if you can, or at least the school you're interviewing for, or the program or the job that you're interviewing for. And find out what they're known for and what they're proud of, and ask questions and get them to talk about themselves, and they'll like you a lot better. So in general, the more you can get your date to talk about themselves, the more they think you're attractive. And that works for interviews too. So that's my quick and dirty tactic, but I'll be more than happy to go more in depth. You know, some common questions are why you want to be a pharmacist, you know, what are your career goals? How do you multitask? How do you handle stress? How do you prioritize? Tell me a story about when you went out of your way to help somebody, or, you know, those are very common interview questions. All right, I think we have like 4 more minutes. I've told you my deep and dirty, my darkest personal secrets. So feel free to ask any questions. But yeah, I do love my job. And I love that if I ever stop loving it, I can still be a pharmacist and change fields, right? Change areas, and my job will look entirely different, and it'll be new and exciting again. It's also why I love academia. You know, I love being a teacher because every day is a little bit different. I don't know any other profession that you can have that much variability in your job. Well, it looks like all the questions have been answered for. Oh, there's one more question. Does your LOR have to be from a pharmacist or a professor? No, it doesn't. It doesn't. It really doesn't. You know, if you can get somebody to talk about your personal, I think a pharmacist or professor are really safe options, right? Like if you generally have you do 3 layers of rec, one from a professor, if you can, one from a pharmacist, and then, but even just one that can talk about your work ethic or your responsibility or your compassion or your, you know, you as a person. That's really what we're looking for. But it is always good. I'd say more important than the professor is probably the pharmacist, or at least someone in the medical field. So physician, nurse, you know. In the end of the day, we want to know that you're dedicated to your patients and that you're going to take responsibility for your patients. All right, well, looks like we are wrapping up. So hey, thank you guys so much. I know you guys have a lot of other cool things to be doing, so I appreciate you spending some time with me. But yeah, feel free to email me, you know, anything. I'm more than happy to help out or answer any questions. So, but thank you
so
guys.
much, Dr. Gu. We really enjoy having you at our workshops, and I'm sure all the students really like to hear from you. Let's see. Yeah, so Tama just sent in the chat or evaluation, so don't forget to fill it out for the session. You can find in the chat. It'll also be in a post-screen survey when you leave this event, and then we'll also email it to you guys. So I'll make sure to include Dr. Gu's email so that you guys can contact him if you have any other questions. If you guys are interested in the early acceptance program for DKICP, our advisors can meet with you if you want more information about that, if you're interested in the program. Yeah, thank you so much for coming to our event, and thank you, Dr. Gu again.
There's one more question. So if you get accepted into the pre-pharmacy admissions program, can you still complete your bachelor's consecutively? Yes, absolutely you can. Mm-hmm. You can actually delay and push back your start date and complete your bachelor's, or right now we do offer a bachelor's in pharmaceutical sciences, which is if you don't get your bachelor's, you basically get it in pharmacy school. So you get kind of a free degree. So, you know, if it means a lot to you, that is something that our program has. All right, thank you guys. I'm gonna go cook some dinner. So
thank you so much.
Take it easy.